Hello, everyone. Welcome to episode 53 of our LAMP TCM and Acupuncture series for beginners, or the TCM Basics, brought to you by LAMP Foundation. Let's start the ball rolling with the first presentation. Let's welcome Ma'am Lynn Galarita of Quezon City. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. So we'll continue our discussion on the five element disharmonies. We left off last with the over-controlling cycle. For today, we go to the insulting sequence patterns or the counteracting patterns. So first up, we have wood insulting metal or liver counteracting the lungs. In this condition, we can see cough, asthma, feeling of distension of the chest, and hypochondrium. Next pattern is metal insulting fire, or the lung counteracting the heart. So here we have palpitations, insomnia, and breathlessness. Next pattern is fire insulting water, or the heart counteracting the kidneys. Here we have malar flush, dry mouth at night, insomnia, dizziness, lower backache, and night sweating. Fourth pattern is water insulting earth, or the kidney counteracting the spleen. This will present with loose stools, edema, tiredness, and weakness of the limbs. And lastly, we have the earth insulting wood, or the spleen counteracting the liver. This will present with jaundice, hypochondriac pain, and distension. Now we go to the cosmological sequence. This sequence differs from the other four sequences in that this is a square configuration with Earth as the central pivot point. The other four sequences, the generating, the controlling, the over-controlling, and the insulting cycles or sequences, assume a pentagram design or the star-like design, my 5 points na star. So this sequence emphasizes three important concepts. First, that the earth is a neutral center in the flow of qi and in the cyclical transition of elements. Second, that fire and water represents opposite poles along a vertical axis. And the third, at the center of is the earth, which represents man, the neutral center of the axis. So this is all for now. Thank you for listening.
Thank you very much, Ma'am Lynn. We'll now go to the second presentation. Let's continue with wood element concept. We have here an example of excessive and spontaneous bleeding, epistaxis. Treatment, we use lung 1, lung 7, the front move point and the luo connecting point, respectively. This will cool the organ. Luo tonifies the yin and sedates the yang. Liver 5 is the luo connecting point of the liver. Then we use the extra point intang and Li20, which are local points for the nose. Gallbladder 20 using the heat elimination needle technique. Spleen 6 to descend the energy. The treatment here is mainly prophylactic. We do this once a week for 4 sessions, then once every 2 weeks for another 4 sessions. For excessive bleeding during menstruation, we have the patterns: fire heat in the uterus, which actually corresponds to the urinary bladder in TCM, and fire heat in the liver. Treatment, Ren3, front move of the bladder, which cools the uterus. We also use the lower connecting point of the kidney, kidney 4, to tonify yin and sedate the yang. Liver 5, the lower connecting point of the liver. Spleen 6, distal point for the lower abdomen. Bladder 40, an earth point, tonifies the yin of the urinary bladder through the controlling cycle. Treatment for liver blood deficiency, we use Ren 13, bladder 15, which are the mu and shu points of the heart to tonify yin and yang. Heart 9, SI3, tonification points. Bladder 17, the influential point for the blood. Gallbladder 39, influential point for the marrow and iron. Treat once weekly until symptoms improve. Problems with release of blood when it is necessary to bleed cause symptoms such as dysmenorrhea at the onset of bleeding. This is called liver blood stagnation. Normally, the menstrual bleeding is heavier when the bleeding starts and decreases after 2 to 3 days. In patients with a deficiency of the liver function, or Qi, the uterus finds it difficult to eliminate the blood at the onset of the period because the liver does not release the blood readily. It takes 1 to 2 days of much pain and cramps in the uterus and other symptoms like nausea, dizziness for the liver functional Qi to improve in order for it to release the blood. The patient complains of severe pain at the onset when the bleeding itself is little because of the liver blood deficiency, dark and clotty. This indicates that the blood is not flowing but stagnating in the uterus. However, when the bleeding becomes more fluid and flows out easily on the 2nd or 3rd day of the period, the pain improves greatly. Women who have this dysmenorrhea also tend to get endometriosis because when the uterus contracts in an effort to eliminate the blood out of the cervix, the blood gets squeezed into the peritoneal cavity through the fallopian tubes. If the liver function does not improve, endometriosis can recur after surgery. Thank you so much for your attention. Let's now call back Ma'am Lynn Galarita for her topic on menstruation. Good afternoon, Ma'am Lynn, ulit.
Good afternoon ulit, Dr. Hector. Good afternoon, everyone. So let's continue our discussion on menstruation. So for today, we'll talk about the different acupuncture treatments for different problems related to menstruation. So first up, for kidney yin deficiency, we use kidney 4, which is the lugo connecting point of the kidney. This point tonifies yin and sedates yang. Usually in kidney yin deficiency, there is a short cycle. So this occurs because of early ovulation or because of a shorter second phase of the menstrual cycle. Kidney 4, or the lugo connecting point of the kidneys, not only tonifies the yin, but it also sedates the yang, and so delays the ovulation and lengthens the second phase of the cycle. Second point is spleen 2 or 3. These points tonifies spleen yin. But to further explain the use of this point, the reproductive kidney gets its energy from the organs of the earth element, and the organs of the metal element nourishes the water kidney. Next point is spleen 6. This is a distal point. Next point is Ren 3, or the front view point of the urinary bladder. If spleen 6 is distal, this one is the local point for treatment. So additional advice, to drink more water, take enough rest, and keep cool. So for the next pattern, we have fire heat in the kidney and the liver. For this problem, we also use kidney 4. the Lu connecting point to tonify yin and sedate the yang. Again, we use Ren 3 because this point also cools and calms. Next point is urinary bladder 40, which is the earth point and also the grandmother point. This point tonifies the yin of the uterus. We also use liver 5, the low connecting point. This tonifies yin and sedates the yang. Next point is spleen 6, the distal point of the lower warmer. For kidney yang deficiency, we use UB23, the backshoe point of the kidney. This improves kidney function. We also use kidney 3, the earth point, which is also the grandmother point, as this tonifies the yang. Next point is UB67, the tonification point of the coupled yang organs. Another point is Ren 3. We use moxa here to increase local heat. And the last point is spleen 6, which is also the distal point. So this is all for now. Thank you for listening.
Thank you very much, Ma'am Lynn. Next topic is on metal element. Lung ascends and descends water. So it is said that we have 3 lungs. This includes the 2 lungs and the skin, which makes up the 3rd lung. The lung has to irrigate all of this. In order to do so, it has to both ascend and descend water. So let's study the diagram. So this actually tells us about the blood and water metabolism. So water and food will have to go to the stomach, and the spleen will have to transform it and transport it. And then whatever is, and of course the water will have to go to the kidney, disturb it, and then the urinary bladder for the urine. So the clear part of the water will have to go back to the lung, and where, with the help of the heart, it will go to the skin surface. So this is the ascending component, the ascending function of the lung. So the descending function, or the ability of the lung to descend the water, is represented by the fact that whatever is turbid will have to go to the kidney for further purification and eventually for excretion into the urinary bladder as urine. Food and drink enter the stomach from the mouth and is digested by the stomach and absorbed by the spleen. The spleen sends this nutrition and water to the kidneys. The kidney uses this in the making of blood in the marrow, in the bone marrow. The blood made by the kidney is not oxygenated. So the kidney sends this blood, the nutrients and water, to the lung. The lung also brings nutritional energy to the blood through respiration. The heart uses all these factors to synthesize red blood and circulates it centrally to all the body, with the peripheral circulation continued by the spleen. Food and drink. So, as we could see from the previous slides, will actually have to end at the bladder. And this, here you can see the role of the lung to actually ascend and descend water. So let's take a look at this pattern in which there is difficulty to ascend water, manifesting as skin problems. So if you see a thin and dry skin, there is less water both under and over the skin. So that means the lung has too little yin to ascend. So for thick and oily skin, if you have thick and oily skin, there is much dampness both below and on the skin. So that means lung yin is in excess and ascends much dampness to the skin. thick and dry skin, dampness below the skin surface, but it is unable to rise to the skin surface. This is because the function of opening and eliminating is poor. Examples are psoriasis, eczema, myxedema. Treatment points to improve ascending function of the lung. We use the Bakshu point of the lung, which is bladder 13, to improve the function. Then the fire point or grandmother point, which tonifies the yang. So we use lung 10. LI11 tonification point for indirect tonification of lung yang, and steam room, wet sauna, and warm weather to help the skin to eliminate. Then we have difficulty to descend water that manifests as lung problems. Excessive mucus and lung edema indicate that the lung is full of damp, but does not descend to the kidneys. Why not? There are two possible reasons. Number one, the lung has difficulty descending water to the kidneys. So the treatment would be, we sedate the lung on lung 5, which is the water point. Sedating a point on the meridian will help the meridian disperse the excess energy. The point one uses to sedate will determine where this energy should flow. Lung 5 sedation will disperse lung yin and send it to the yin organ in the water element, the kidney. Or number 2, the kidneys might be too full of water to receive the fluid from the lung. This may be a patient with poor kidney function or heart failure. The edema is generalized and the lung is only a part of it. Treatment. So with needle and cup, bladder 23 to increase diuresis. Then we use Luo point, bladder 58, to tonify the yang and sedate the yin. Bladder 39, the lower C point of triple warmer, which harmonizes water for the whole body. And Ren 5 and 9, needling and cupping. These are excellent empirical points for water retention and lymphedema. Thank you very much for your attention. Let's welcome Ma'am Lynn once again for Qi. Good afternoon, Ma'am Lynn.
Good afternoon ulit. Now let's continue our discussion and review on Qi. Okay. All Qi is ultimately one Qi manifesting in different forms. So how is Qi created? Food and water are taken into the body via the mouth, taken down to the stomach and spleen, where it is transformed into Gu Qi. So yung quality ng ating Gu Qi nakadepende doon sa ating kinakain at ating iniinom. So Gu Qi is then raised up to the chest where it combines with Kong Qi, which is formed by the lungs from the air. Combined Kong Qi plus Gu Qi is called Zong Qi. Yuan Qi from the kidneys acts on Zong Qi and transforms it into Zhen Qi, or the upright Qi of the body. Zhen Qi then can split into two, which is the Wei Qi, or the defensive Qi, and the Yin Qi, which is the nutritive Qi. Here is a flow diagram of the Qi creation. So with Kong Qi from the air and Gu Qi from the food, this forms our Zong Qi, plus the Yuan Qi from the kidneys, or our pre-heaven Qi. This will form the Zhen Qi. And this in turn is composed by the Wei Qi and the Yin Qi. Okay. So what is the Yuan Qi, or the original Qi, or the pre-heaven Qi? So, Yuan Qi is derived from essence. The Yuan Qi is also known as the pre-heaven Qi and is inherited from our parents at conception. Yuan Qi has its roots in the kidneys and spread throughout the body by the Sanjiao, or the triple burner or triple heater. It is the foundation of all the yin and yang energies of the body. Okay. So what are the functions of the Yuan Qi? First, it promotes and stimulates functional activities of the organs. And second, it provides the foundation for the production of the Zen Qi. So it is distributed, or it originates in the Mingmen, or the gate of vitality, and circulates via the Sanjiao, or the triple warmer meridian, pulls at the meridian at the Yuan source points. So why is the Yuan Qi important? Deficiencies in Yuan Qi may lead to poor development of post-heaven Qi. Okay. Now for the Gu Qi, or our food Qi. It originates from the action of the spleen on the food in the stomach. Gu Qi is the first stage in the transformation of food. Food is first rotted and ripened by the stomach and then sent to the spleen to make Gu Qi. Its function is to blend with Kong Qi to form the Zen Qi. Gu Qi then is transformed into blood. So kung wala tayong kinakain, wala rin tayong mabubuong dugo. Gu Qi is sent to the lungs, then passes to the heart, where, with the help of the Yuan Qi and kidney Qi, it is transformed into blood. So why is this important? Again, good quality of food and a healthy stomach and spleen are important to generate energy. Weaknesses in the spleen may lead to bloating, distension, fatigue, loss of appetite, and loose stools. As for the Zong Qi, it is a combination of Wu Qi and Kong Qi. Its function is to nourish the heart and lungs. It is the basis for the involuntary functions of heartbeat and respiration. Zongzi assists the lungs in controlling qi and respiration and circulating energy throughout the body. Zongzi also assists the heart in circulating blood through the vessels and governing blood. Zongqi and Yuanqi assist each other. Zongqi flows downward to aid the kidneys, and Yuanqi flows upward to aid in respiration. So, Zongqi is stored in the chest, gathers in the throat, and influences speech, which is under the control of the heart, and the strength of voice, which is under the control of lungs. Strength of Zongqi can be determined from the health of the heart, the lungs, and form the circulation of and voice, and form circulation and voice. Okay. If Zongqi is weak, the hands will be weak or cold, and weak voice, and there will also be low energy. It is easily affected by emotional problems. For example, grief weakens the lungs and disperses energy in the chest. So that's all for now about Qi. Thank you for listening.
Thank you very much, Ma'am Lynn. We now proceed to water element concept. We will resume where we left off. Okay, let's talk about slow growth. This time, slow growth with well-developed bones and joints. So that means the yang is very deficient, but the yin is is okay or in excess. So let's start with kidney yang deficiency. We use the Bakshu point of the kidney, which is bladder 23, the earth point, kidney 3, tonification point, bladder 67. Red meat, red fish, because the yang is deficient. And the food should be cooked and warm. We also use stomach 36 and LI11. We treat once weekly for 12 sessions, then once every 2 weeks for every other week for 6 sessions. Then we have kidney yin excess and yang deficiency. Treatment, we still use bladder 23, but this time we use bladder 58, the luo connecting point of the bladder, kidney 3, earth point, and exercise and warmth, then many local needles in huato points on the back and near joints. Treat twice a week for 3 months, then repeat after a 3-month interval. Okay, poor growth with poor development. So both yin and yang are deficient. Both kidney yin and yang are deficient. We see plenty of this in children in developing countries. Mukhang ano, very relatable tayo dyan, no? Their problem is mainly nutritional. Years of malnutrition make them thin and small, and they are very short indeed when compared with children of affluent families in those countries or an average child in Western countries. Children with eating disorders such as anorexia also suffer growth retardation. So the treatment is to improve nutrition and strengthen both the spleen, stomach, and kidney, urinary bladder. There should be a healthy, balanced diet with lots of protein, milk, products, and fluids. So if you want to create a race that is healthy with adequate growth and good development, then we should nourish our constituents, no? Our children. And it should start from educating the families about it, or probably teach them how to improve the yin and the yang. Okay, so thank you very much for your attention. We bring you once again, Ma'am Lynn, for meridian theory. Ma'am Lynn, good afternoon ulit.
Good afternoon ulit. Okay. Still on the meridian theory, we now discuss about the extra meridians. So apart from the regular meridians, we also have the extra meridians. While the regular meridian circulates the energy of the organ systems, and the extra meridians, on the other hand, circulate the energy of the general yin, yang, blood, and qi of the body. Thus, this extra meridians passes through the different regular meridians. These are the confluent points of the 8 extra meridians. Number 1, for the Ren meridian or the conception vessel, we have lung 7. For the Du meridian or the governor vessel, we have SI3. The Yin motility meridian or the Yin Chao, we have kidney 6. The Yang motility meridian or the Yang Chao, we have UB62. The vital meridian or the Chongmai, we have spleen 4. The belt meridian, which is the Daimai, we have GB41. The yin regulating meridian or the yin way, we have pericardium 6. In the yang regulating meridian or the yang way, we have triple warmer 5. There are many ways to use the extra meridians. As the acupuncture experience differs in different areas of China, the uses of extra meridians also differ. The use of the extra meridians to balance the energies of the whole body. That is when the yin or yang of the entire body has a similar type of imbalance. In this case, it would be more efficient to treat the body in its entirety and not organ by organ. Okay. The extrameridians do not have tonification and sedation points, but one point which can be used for both. These are called cardinal or confluent points. This can be tonified or sedated to give the message to the meridian. Say, for example, that a patient presents with yang dominant states in 3 different elements, like hot flushes with tachycardia, gastric acidity, and red and inflamed lesions on the skin. We could sedate the yang of these organs one by one, but then this yang would circulate round and round in the energy flow. Or we could sedate the Duma regions or the Duma region, and this would sedate the general yang of the body. Having yang excess in 3 elements does mean more than 50% of the body is in a similar state, and sedation of the meridian would sedate all the yang of the body, which could mean that it sedates the yang of the organs that do not have yang excess as well. But when sedating the whole, the areas that have more yang than others are dispersed more. Okay. So mas makakatipid tayo din po ng gamit ng needles when using the extrameridian. But if the organ suffered yang dominant symptoms over a longer period of time, this would be a deficient situation, a deficiency of the general yin in the body. This again would be treated more effectively with tonification of the Ren meridian, as it is the most yin meridian of all. Tonifying 3 different elements individually would need many points, and we will be drawing on organs with yin deficiency to fill other organs with the same problem. Which brings us to another question. When we tonify Ren meridian, where does the energy come from? When sedating the meridian, where does the energy go to? These are meridians that have their own energy, but also have a close relationship with the kidney and the urinary bladder meridians, as these run very close to the Ren and Du meridians on the front and back of the body. If the kidney and urinary bladder were weak, this should cause the Ren and Du meridians to share some of their energy, and therefore should be weakened somewhat too. Okay. That's all for now. Thank you for listening.
Thank you very much, Ma'am Lin. We now come to the last presentation for this afternoon, still on chronic fatigue syndrome, the Chinese concept. So let's review the clinical manifestations of latent heat: weary limbs, irritability, insomnia, slight thirst, slight feeling of heat, lassitude with sudden onset, dark urine, red tongue, rapid fine pulse. All acute heat manifestations in the Yellow Emperor's Classic of Internal Medicine are explained as the transformation of cold, as the study of exterior diseases was at that time dominated by cold as the main pathogenic factor, and even more so later with the discussion of cold-induced diseases by Zhang Chongqing. Although the basic concept expressed in the simple questions is valid, first, the original pathogenic factor is not necessarily wind cold, but may also be wind heat. Second, it may penetrate, not necessarily in winter. Third, it may come out not necessarily in spring. Please note also that the fact that latent heat emerges later does not mean it is being expelled. It is simply coming to the surface and manifesting itself after incubating in the interior. Besides causing the above symptoms and signs, latent heat will also tend to injure qi and yin, thus establishing a vicious circle of heat and deficiency. The emerging of latent heat, which is nothing but a form of interior heat, is a reverse process to that of penetration of heat in the four levels. According to the theory of the four levels, exterior heat invades the body at the Wei Qi level or defensive Qi level. After that, if it penetrates into the interior, it goes through the other three levels, the Qi, the nutritive Qi or Ying, and blood levels. Latent heat moves in the reverse direction. It goes from the blood to the nutritive Qi to the Qi and to the defensive Qi level. Please note again that this outward movement does not mean that latent heat is being expelled, but simply that it is manifesting itself outwardly. So here is a diagram for the pathology of latent heat. So again, the external wind could be bacteria or virus invading the body. It does not cause immediate infection, but the pathogenic factor incubates inside, changing into heat to emerge later as latent heat. And latent heat can impact the qi and yin, so it injures the yin and the qi, and of course, when you have qi and yin deficiency, this will lead to heat. Okay, so we have here the latent heat movement in the four levels. So as explained earlier, during wind invasion, it first penetrates the outermost, which is the Wei, or the defensive Qi layer. And if it interiorizes, it goes down to the Qi, Yin, and Shui, or blood levels. But for the movement of latent heat, it's the opposite. Okay, so from the interior, from the blood level, goes back up to the Yin, Qi, until it emerges to it emerges at the surface, at the Wei Qi level. This process of incubation of an exterior pathogenic factor in the interior to emerge as heat later explains many cases of chronic fatigue syndrome. Latent heat can emerge on the surface by itself, or it can be pulled towards the surface by a new invasion of external wind. In this case, in addition to the above symptoms of interior heat, there would also be some exterior symptoms such as shivering, fever, occipital headache, aches, and sneezing. However, the pulse, which is fine and rapid, and the red tongue clearly point to interior heat. Thank you everyone for joining. We hope to see you again in our next presentation. Thank you.